As we get older, it can be more and more difficult to find your balance, and that then can bring some health risks associated with that. So we're going to help you this morning. Glad to have Becky Geren back from CHI Memorial, a physical therapist.
Good
there.
morning.
Good to see you.
You too.
So I didn't think about this on my own. I learned about it years ago on the show from somebody who works in a nursing home in town, that as we get older, our balance we begin to lose it, right?
Yes. Unfortunately, as we age, our balance system does kind of deteriorate, so that can cause some issues later in life.
So you're wanting to talk today about something called balance therapy. You don't have to have had an injury to do this.
Absolutely not. We hopefully would like for patients to come in looking to prevent an injury because they may have noticed some issues with their balance or maybe an increased fear of falling.
What kinds of things do you do in balance therapy?
Well, after an initial evaluation by a physical therapist, then we will develop a treatment plan that is individualized for each patient. So it really kind of is based on what maybe is the cause of their balance. There can be some limitations with some vision. There can be some weakness that's present that we want to address. There can be some impairment in what's called the vestibular system, which is our balance center in our brain. So dependent on what areas are mostly impaired, we will direct our treatment plan to work on those avenues and then also address the other aspects of balance as well.
If you're doing it as a preventive measure, do you need to have a doctor's order? How does insurance cover that?
Generally, insurance requires a doctor's order. We can go ahead and evaluate you without one and then move forward with attaining one as needed.
Okay. You mentioned the brain component of it. So suppose somebody's watching and they've recently been diagnosed with Alzheimer's. Does that diagnosis tend to lead to balance concerns?
It can, yes, it certainly can. Unfortunately, as the brain deteriorates in that area, then there can be some motor control issues and folks begin to have some balance problems. They tend to have a change in their gait pattern. So with that intervention, some caregiver education is also important to help train the individual that may be caring for the patient on how to prevent falls in the home.
That's a good point. Okay, how about common things that are just hazards for us if you're not paying attention? Curbs?
Curbs, throw rugs in the home, walking in unlit areas when we jump up in the middle of the night and running to the bathroom. So making sure you have a night light or something that close by that you can turn on. Lit walkways are really important. And then slick areas, just being mindful.
Is it is it a matter of strengthening both sides of your body? Like if you have a strong hamstring, but the back of your leg is weak, is that kind of what can throw you off?
That also can. Muscle imbalance can certainly throw you off. So we do want to address all aspects of muscle strength, muscle control.
And if you are wondering, okay, gee, is this happening to me? Since you said prevention is your key, how do you know if this is something to look for?
Call your physical therapist. There are multiple tests that we can use to assess balance, to assess your fall risk, and then from there we can develop an appropriate treatment plan. It may be that we just give you some basic exercises and recommend starting an exercise program for wellness. It may be that you need some more intensive skilled physical therapy for several weeks and then hopefully transition you to exercise on your own.
When you were here last time, I mentioned how some people feel like physical therapy can be a painful thing.
Yes.
In this particular case, it's more strengthening, right? Because there's no injury.
It is. Generally, this is a pain-free intervention. There is some confidence that may need to be improved, and so that fear of falling sometimes can be a limitation, but generally this is more of a pain-free.
And if you've had an injury, right? If you've had an injury and you've gone through physical therapy to correct your injury, could you then ask for a continuation for the balance therapy so that you can be strengthened in a different kind of way?
Absolutely, and we do try to address the whole patient in that instance when there has been an injury. We want to address the injury, get that healed, but then make sure that we address the patient's full mobility before discharging them to an independent exercise program.
Okay, so there are two ways you can reach her. The simplest thing is to go to the website that you see there on your screen. You'll find Becky, though, at the Hickson location at Memorial North Park there in Hickson. There's also the one at the Hamilton Place YMCA right there inside the Y.
Yes.
So then they're utilizing the equipment there in-house to help you get on your way.
Absolutely.
Thank you, Becky.
Thanks, Julie.
Back after this.